So thank you to the EDS Society for inviting me to speak today at the Summit for Fatigue. I'm delighted to present the topic of nutrition and fatigue to you. I'm Lorna Ryan, and I don't have any disclosures. So what we'll cover today is some potential links between nutrition and fatigue, looking at potential cause and effect of those dietary influences on fatigue. We'll go through some nutritional strategies, some lifestyle themes, and we'll review one patient case study. And today we will not be talking about nutrition related to pregnancy, to children, or a one-size-fits-all supplement and diet protocol. So I know you would have listened to some talks today already, but for purposes of this presentation, I want to make sure we're on the same page. I'll be referring to fatigue as the medical term of extreme tiredness, lack of energy, and that could become from mental, physical exertion or from illness. And we'll be referencing fatigue as it prevents an individual from functioning normally, and then is potentially a chronic persistence, which is 6 months or more situation. And we really want to acknowledge how individuals might be experiencing very fluctuations in their fatigue symptoms. So let's delve in with where the nutrition evidence is for chronic fatigue. And this is a broad stroke overview, so it's not hugely comprehensive. But what we know when we look at scientific literature and research is that the underlying mechanisms for fatigue are still not completely understood. There's lots of gaps in knowledge. And from a nutrition point of view, a lot of the literature focuses on the nutrients of iron, vitamin B12, B9, B6, magnesium, and vitamin C. There's quite a lot of suggestion about anti-inflammatory diets, reducing stimulants such as caffeine and alcohol that can modify some chronic fatigue presentation. And there's a general consensus that modifying food intake seems to influence not only the perception of fatigue for an individual, but also their presenting symptoms. So when we're looking at fatigue presentation in EDS and HSD, we know that it might be indistinguishable from chronic fatigue syndromes, and that a medical diagnosis might be uncertain, and your medical care team will want to exclude any other condition that might be producing fatigue for you. And then we move on to considering any comorbidities which might present for the EDS population. And then where are we with absolute specific evidence for fatigue in EDS? Well, we're not far because it's very lacking. So we don't have robust literature for nutrition management in EDS. What we look at is being informed by evidence for the chronic fatigue syndromes, and then also considering some outcomes of literature research for the comorbidity conditions. And of those, we're discussing the GI concerns, POTS or wider dysautonomia, MCAS or wider mast cell disorders, pain and anxiety. So when we then start looking at potential links between nutrition and fatigue for our EDS population, we want to ensure that we're all on the same page of referencing nutrition as dietary intake, which may include foods, drinks, and supplements. And we also want to acknowledge that this does depend on an individual's presentation and comorbidities, and that nutrition is really vital to support your foundation of health. And what we're really trying to do with nutrition for fatigue is to improve your quality of life. And then we do this by making sure we're framing our considerations of nutrition for your general health, which is critical for your health and development at whatever life stage you are, including disease presentation. And it's protecting against malnutrition and providing key nutrients for organ systems. So this might be cardiovascular, GI, and then wider systems. What we're looking really is to rely on a balanced dietary intake. Now, balance can mean many things to many people. And so here we're looking at a balanced plate. And this is a plate that's representative of all of our food intakes, and they're very widely used around the world in nutrition science. What we're wanting to make sure in these approximate ratios is that we have an abundance of fruits and vegetables, carbohydrates, some dairy or alternates if someone doesn't consume dairy. And then our proteins, again, very varied. The picture it's not exclusive to every food on the planet. What's most important is looking at the ratios and proportions. And then we want to be looking specifically now at our considerations for nutrition for HSD and EDS comorbidities. Now, these are what we'd call like the main focuses. So if one comes to clinic, these would be the key things we're wanting to just have an assessment around. So if someone has fatigue with GI issues, we're really quite interested in malabsorption. So that's how well you're absorbing your nutrient from food or supplementation. And then how well are you detoxifying? So is there impaired detoxification? And this, to be blunt, is all about how you poop. Are you constipated? And with POTS and also wider dysautonomia, we're very interested in your hydration, your meal sizing, and also vitamin B12 status. Now, mast cell or wider mast cell disorders, MCAS or wider mast cell disorders, we're going back to GI issues, but we're also very interested in vitamin D status, inflammatory processes, and also states of malnutrition. And the malnutrition, what we observe, is coming from this restriction of foods. And then pain and anxiety are very quite complicated, unknown phenomena with fatigue. In the realms of nutrition, we're wanting to assess your sleep and your dietary intake, as well as meal timings and iron status. And then we want to focus on any dietary influences. Now, remember that today's presentation is framed in the session of the pacing, so we're not really getting into the nitty-gritties of nutrient science of fatigue. What we want to look at is, are there any influences on your diet that might be contributing to fatigue? And here we have what I like to use in clinic as our 6 elements of considerations or influences. So we have quality of foods. We're looking to see if you're having a lot of heavily processed foods, a lot of refined sugar. We're looking at hydration. Do you have too much or too little water or fluids? And maybe where are you sitting with electrolyte needs? Dietary intake, we're looking at the key macronutrients of proteins, fats, and carbohydrates, as well as delving into what's happening with your fiber intake. And there's multifactorial reasons why we're quite interested in this particular dietary intake. But overall, we're getting a good sense of what foods you are eating. With our nutrient status, we're keen to know if you have any deficiencies. The key ones noted there: iron, ferritin, vitamin B12, B6, B9. And then meal timings and meal sizes are very key with fatigue, because we want to see, are you eating regularly, or have you got a long period of time during the day where you're not eating? And are you having quite large meals and dense portions, which we know, particularly if you have the GI or the dysautonomia complications, can actually be quite fatiguing even on their own. And then we really recognize how all of these elements can feed into having some fatigue presentations. And actually, it's important to note that this is for general population, not just those living with EDS and HSD. Many people without sort of complicated health challenges or medical diagnosis will often have some fatigue when all of these elements are not optimized for the individual. Now we want to just have a ponder on cause and effect. So can dietary influences and fatigue be linked? Yes. So if you are fatigued, you're in a state of a flare, or prolonged this persistent fatigue, you may have a pattern now of you're just not motivated and you feel very overwhelmed with food intake or sleep or movement. You might be very confused about your diet, and this might come from a position of, I just don't know what to eat to make me feel better. You might also have some barriers now for food preparation, cooking, and intake, even getting food into your residence. And then fatigue in itself can actually drive some loss of appetite in people. So here we are. We're at the chicken and egg situation. What comes first? Poor dietary intake, some influences on dietary patterns, or fatigue? Or does being fatigued drive poor dietary intake and dietary influences? So we go round in a circle with the good old chicken and egg situation. We then also want to just have a very mindful consideration of the broader lifestyle factors. As you'll see, diet and fatigue here in the center really sits among all these other elements. So what's your sleep doing, your movement, environment, physical, spiritual well-being. And down at the bottom, emotions and mind, won't touch on them because actually there's a lot unknown with the how things interweave with fatigue. And they are very much areas for different scope of practice than a nutritionist, but they're definitely there to be considerate of. So then we ask the big question, how can we positively impact our symptoms of fatigue? Now, this is questions to ask if you're a clinician, but it's also issues to maybe report if you're a patient. And we want to fundamentally understand that what we're aiming on is practical and simple nutrition strategies, being mindful of our broader lifestyle factors. Absolutely fundamentally, we need to be mindful of an individual's medical case and causality for their fatigue. So if you're a clinician, someone comes into a nutrition clinic with a lot of fatigue, we want to make sure that we've gone through everything that might need a red flag assessment, but B, where we know that there's a more health disease process contributing to fatigue than the nutrition. And for patients, be aware that dietary intake and nutrition, yes, is important, but if you've got a particular medical case, the causality might be a little bit more serious, and we can't say that nutrition is going to definitely improve that for you. We also really want to just understand the message that there's no diet, isolated supplement, or intervention of our lifestyle that will improve symptoms of fatigue. But what can we do? So we have some base nutritional strategies, and these go back to the 6 elements. And what we're wanting to do is to ensure that we have really good quality of foods, from fresh produce, whole foods, limiting those artificial flavors, colorings, etc. And on the hydration front, we're wanting to ensure you have sufficient fluid and electrolytes, but this is very individual. So we cannot give broad stroke values here, because what country you live in, is it hot or cold? Are you doing exercise even though you're fatigued? And also what age you are. So there's so many individual factors relating to hydration, but what we're wanting to assess is, for you as an individual, are things optimal? And the same goes with dietary intake. We're focusing here on your main core macronutrients, your proteins, fats, complex carbohydrates, as well as your different types of fiber types. It's going to provide your body with energy, but also support your gastrointestinal functions. And I always have a little nod here to just think bowel movements. So we're wanting to go back to making sure that you're detoxifying properly. With our nutrient status, we're wanting to correct any deficiencies, and this may need medical treatment before a food first approach. Meal timings and meal sizings, we're wanting to ensure that there's a really good optimal pattern for you if you want behaviours around having regular meals, and increasing frequency if maybe for whatever reason, generally GI or POTS manifestations, you can't cope with larger meals. And we're wanting to divide your meals up so that over the course of a day, you're still having a good intake of foods. You're not decreasing overall intake just because you're having smaller sizes. We then add on elements of sleep and breath work and stress and movement. Now, breath work and movement is definitely in the areas of some of our wonderful experts in that modality. Stress is very multifactorial. I've put here about reducing physical and mental stress, but we must acknowledge, if you're living with mental health challenges, it's just not that simple, and please seek appropriate healthcare support. And then with sleep, what we're aiming on is to focus on a better sleep-wake cycle. Some people may also have more medical sleep conditions, in which case that would come under our causality, that we're hopefully going to other healthcare practitioners to have some support on. Going to focus now on our key considerations. Most important, number 1 and 2, is iron, ferritin levels and vitamin B12 levels, and these would be determined from a blood test, hopefully under your GP or medical consultant or qualified nutritionist. If you have got low levels, which would be classed as deficiency, this is actually a medical diagnosis. You'd be iron deficient or B12 deficient, and actually both of those warrant a medical assessment to see why you might be deficient. It isn't as easy as saying, well, you're not consuming many iron-rich foods, therefore that's why. There's lots of other factors that might be involved here, so we want to make sure your doctor's looking into that for you. And the doctor is really going to take over that treatment for these deficiencies, and that's going to either be pharmaceutical, prescription tablets, injections, or iron infusions. But we do have some other nutrient considerations. Now, these are listed here: the magnesium, CoQ10, vitamin C, and the B group vitamins, which include vitamin B6 and B9 that we read in literature. This does not mean you supplement to improve your energy. What it means is that they all have a role in helping the body use energy from food. So I know it's a little bit wordy, this slide, but if you read, they all convert the food you eat to energy, the glucose you eat from food into energy, and energy yielding metabolism. So what these nutrients do is they help your body to get a little bit more energy when you're fatigued. And actually, if you look at the food sources, they're in a wide range of foods. So if you go back to that balanced diet, you will be consuming these key nutrients that we want to consider in clinic. So this is your meats, your dairy products. You can do it from a vegan diet if you are vegan. But then overarching whole grains, good vegetables, good carbohydrate sources. And then we move to actual dietary intake. And this is something I hear a lot in clinic is, I'm just too fatigued. I'm too tired to think about what to eat, to actually eat the food, prepare the food. So what I always say to people is, we just need a bit of help. So this is if your patient asks for the help and know that this help is there. And if you're a clinician, offer the help. So I'm going to start with aids that can be used to help you with daily feeding. And feeding, I'm meaning physically eating orally the food, not referring to being fed via a tube or tube feeding, and assisting with your food preparation tasks. You would have heard from the lovely Emily earlier about everything she does to support people with this area. So your adaptive aids to help with food preparation and intake is occupational therapy assisted and facilitated, usually. And I always advocate someone not just Googling products, but actually asking the relevant professional, because they will know what you need and can advise you how to use the aids as well. We also have cooking appliances if this is safe for you. And these are really just things that's going to help you to prepare your meals, that do the work. Put the food in the morning and then you've got a lovely meal in the evening and you can batch cook. And then pre-prepared goods. I get a lot in clinic that people are very surprised a nutritionist is going to advocate pre-prepared goods. But we're talking about tins and pre-chops, or cans if you're in America, and pre-prepared foods that might store in the freezer or cupboard. Reason being is we need to pick our battles. And if we're really, really fatigued, we just want to get some good food in. And we're going to look at these as methods to get your food in. Tinned food and pre-chopped food and pre-prepared food can be healthy, wholesome, fresh produce. You just need to be a little bit mindful about where you buy from and looking at ingredients. We're wanting to make sure there's not too many of those artificial colours, flavourings, preservatives, etc. Not to scare you from the preservatives, but particularly if you're on the MCAS side or the POTS side, they might not be your friend. So you can be choosing some tinned or canned fish and vegetables, even potatoes, legumes, and pre-chopped. These are your vegetables that's chopped and put in frozen packets. That's just easy to pick out. And then, okay, if we're being purist about it, we don't want people to be having takeaways, but there's nothing wrong in a takeaway if it means you're going to be eating food that day. If you're too tired, we prefer you to have food rather than not have food. And same with ready meals, instant noodles and shop-bought smoothies. They have their place. So now we want to focus on dietary diversity. And I talk a lot about dietary diversity with looking at the overall balance of our diet rather than specifics. Again, this is not exhaustive because we don't know your individual case. I'm doing this presentation to numerous people and you're all going to have very different needs. So we wanting proteins, carbohydrates, dietary fats, probiotics and prebiotics, unless contraindicative for anyone living with mast cell activation syndrome, again, case by case, and hydration. And these are just some of the keys that we'd be focusing on. And it's about looking at what your dietary intake is at the moment and how can you improve on that. And all of these foods are going to be naturally containing those key constituent nutrients we talked about before and helping the body to yield some energy. But it also depends in the timings and the sizes every day of this food consumption. And then what about supplementation? I'm asked a lot. Key, correct deficiency. And then we're looking at supplementation to literally supplement our dietary intake. So if for whatever reason with your fatigue, you're just not meeting your dietary intake of oily fats like your omega-3s or your proteins or fiber, etc., then we can add a supplement to bridge that for you. You can also supplement according to your health goals, so what we call is underpin health goals. And these are the nutrients that we discussed earlier, potentially probiotics if it's not contraindicative, and electrolytes. And this is very much going to vary on individual cases. The same as micronutrients. This is vitamins and minerals. Just as an individual, you might have a specific blood test that shows a nutrient deficiency. And sure, we can add in, if it's appropriate, a supplement there. And it's very dependent on life stage as well. A male in their 20s might need different micronutrient supplementation to maybe a lady in her 60s or 70s, for example. I've added on here single preparations. This is actually one of my keys in clinic, because add one thing in at a time to monitor effects, particularly when you're living with comorbidities. We want to know if it's helping or maybe not helping you. So this would come under side effects. And I'm very keen on considering our liver health. So every supplement you take will go through a liver pathway. So we don't want to be causing the liver to work too hard. And so we only have supplementation if really needed. Our aim then is to focus on modifiable factors that might improve fatigue and that might be influenced through your diet and lifestyle ahead of specific isolated nutrients or food types. So we get the base levels in, we consider the dietary influences fatigue, and then we just take stock. If fatigue is still very present for an individual, then we can delve into specifics, maybe different blood tests, maybe looking at specific food types for you. So now we're going to review a case study. And this is a lady that came to clinic, which really, her case cements everything we've talked about. We're calling her Sally. This is not her real name. She's female and she was 32 when she came to clinic. She had a diagnosis of hypermobile EDS, POTS and gastroparesis, although she, in her own words, feels that she's fairly mild. She's taking medication for pain every day, and I'm not very good at saying this one, prucalopride, and she's been on this medication a long time. She came to clinic taking aloe vera, a probiotic, vitamin D, and a magnesium product. And her main presenting symptoms surrounded constipation, pain, mostly chronic fatigue, some morning nausea and bloating. And her dietary history was a lot of restriction of foods that she had experimented with herself and naturally ended up restricting. But she has meat once a day, a lot of fruit, a lot of starchy carbohydrates. Most of her dietary intake is via smoothies. She's a lot of coffee and not very much fluids outside her coffee or smoothies. And then her lifestyle history is really a pattern of stopping things, stopping her exercise that she loves to do, reducing her work hours and her reading because of the brain fog. But she'd actually started to increase digital screen time on her mobile, and her sleep-wake time, in her words, had just got out of control, and she was going to bed very late at 1:30 in the morning. So as part of our initial consultation, Sally's main goals was to reduce fatigue and improve constipation. So our keynotes here is that in terms of medical review, it's her GP as and when needed. Recent blood test was no action, that everything was reported to be normal, including her nutrient status. Everything was in reference range, and her supplements had been self-initiated. So Sally's symptoms was really around that fatigue profile, not much daily energy, a lot of brain fog, a lot of daytime sleeping, difficulty waking up, MSK is musculoskeletal pain in the afternoon. Sorry, I've missed pain out of there. A lot of increased postprandial pain, which is pain in after eating. And she reports that even on her smoothies. A lot of digestion, morning nausea, and she reports that her stools or her poop is quite hard to pass, so evacuate, and she's having a bowel movement once every other day, which is not her normal, and she's dizzy. So there's a few other notes here. Sally was quite isolated about solid foods. She's keen to return to full-time work, and she really misses her activities. And one of the big things for Sally is that she felt really stuck in how to improve her diet, and she's just too tired to make changes. She was quite compliant to making changes. She came to me at a point where she was just like, I need help. And there was no red flags for Sally, so she didn't need to be referred on to any medical review. So our initial consultation, we split our intervention into two, preliminary and secondary, and it was all around improving constipation, improving base influences that we talked about earlier, like the hydration and the fiber. And then secondly, we were moving towards solid foods and increasing her protein intake. So we did this in 2 stages, week 1 and 2. Sally had specific instructions that we discussed and she agreed on about swapping her coffee around, increasing fluids, adding in stewed apples, which is my favorite form of fiber for constipation. Supplements changed, lifestyle, again, one of my favorites, the potty stool to help with the bowel evacuation. And we were looking to reduce her screen time and adjust her bedtime, aiming on going to bed by 10 p.m. And then the second intervention, week 3 to 4, we were increasing that fiber intake with a chia seed pudding, increasing her protein, and now looking to introduce some different sources of complex carbohydrates. And the food listed here is very much in discussion with what Sally would wanted to include. So 5 weeks later, Sally came to clinic and reported that her constipation had improved. She's now having 2 stool movements a day, or bowel movements a day. And Sally estimated that her fatigue was better by 40%. She'd actually managed to put in most of the steps that we talked about, including bedtime and swapping around the coffee and increasing the complex carbohydrates. Sally reported that she still found it difficult to prepare food because of her fatigue, and she was still very confused about appropriate meal sizes. So our next plan focused on those meal timings and also swapping up some of those snacks for her and increasing some leafy green vegetables this time. Supplements we changed, most notably was swapping her magnesium to a blend and starting electrolytes. And then we said she could stop the aloe vera or probiotics. And lifestyle was really about trying to get that light in the morning in her eyes with fresh air, because this would then impart into her sleep-wake cycle. We also had a really good discussion about Sally engaging with an occupational therapist to help with her food preparation and pacing when cooking. So 5 weeks later, Sally came back and much was improved again, which was wonderful. GI, her fatigue, some days she was napping. She found it fine with swapping all of her supplements. And in fact, she noted that her electrolytes had seemed to really help, particularly in the afternoon. And she'd implemented all the different dietary changes and was enjoying it. She also implemented the lifestyle changes. And of note was her occupational therapist had put in place her adaptive aids, and she found this great assistance. Sally remained to find some days she was having a bit of an afternoon crash because she was trying to push through not having a nap, and she still felt restricted by liquid meals. So we just added a few other elements of this plan. Notably was increasing her electrolytes up to 5 a day with spaced doses, and Sally had quite strict instructions to then discuss with her GP. Because she had found such a benefit of the electrolytes, the discussion with her GP was aimed at whether the GP felt a prescription electrolyte might help her more than what we would call a therapeutic dose electrolyte. Lifestyle factors, we were actually now going to set an alarm at 2 o'clock for a focused nap, and we were going to then start bringing in some other dietary elements that were based on whole foods and opening up her dietary diversity. And Sally wanted to go back to swimming, so we investigated hydrotherapy swimming. And then another 5 weeks later, Sally reported even more improvements, which was really good to see. Morning nausea ease and pot symptoms ease, which probably was the electrolytes and appropriate bowel evacuation, but her pain still persisted. And she was finding that her dietary changes were going well. She was now having 2 solid meals a day. She was still navigating meal sizes, and at this point was finding that 5 small meals a day with snacks suited her well. She had tried hydrotherapy swimming and enjoyed it, and her naps were going really well for her. So her sleep was a lot better. At this stage, Sally found that pain was now actually become her new goal. She was still getting some lower GI bloating, but we discussed how, this is the introduction of more fibers. And at this stage, it was quite normal because her bowel movements were at a place that was better for her. So ongoing, we actually had no new formal clinic plan at this stage because Sally wished to continue this plan for a while. She had clear instructions and guidelines and knew that she had the support to increase her diet, and she was getting that OT support as well for barriers preparing her food. And this is all very clinically suitable. Now Sally's goal was putting all of her efforts and her budget into private physiotherapy to support her pain. And at this point, Sally felt that symptoms of her fatigue had significantly improved and improving quality of life. And so she went on her merry way. The doors open to clinic, but she hasn't needed to come back, which is, a really positive story for Sally. And so my closing thoughts is that if you're living with fatigue, with hEDS and EDS, just consider that we need to formulate our foundations of a healthy diet, which may then, with appropriate attention to nutrient status, influence and improve our symptoms living with EDS and HSD. And I thank you very much for listening.